So welcome back to this video tutorial series on pain management. We're here with Dr. Diarmuid McCoy, specialist pain medicine physician. And for the last couple of webinars, we've been looking at opioids as a medication commonly used in pain management. So we're going to move on now to look at the various other kinds of pain medications frequently used. So Dr. McCoy, could you share with us what other medications are available to you in your armament for managing pain?
Well, in actual fact, for acute pain, we have quite a wide range of agents, from anti-inflammatories, some of these available across the counter, like ibuprofen or Ponston. Other medications such as paracetamol, which is used from a very early age, from nearly 6 months, up to any age group. Quite a safe medication, and one that is used for mild to moderate pain. These are the mainstay of medications that are used for acute musculoskeletal pain. So pain of bruises, injuries, strains, sprains, etc. The anti-inflammatories do have some issues around gastric irritation, so they can cause ulcers when used for a prolonged period, and they can cause kidney damage. And these are two of the things that we are particularly concerned about. So they probably should be used at the lowest dose for the shortest time. There are two main families of drugs, the COX-1 and the COX-2 inhibitors. We talk about ibuprofen and Voltaren and these sort of drugs as the COX-1 inhibitors, and celecoxib and Arcoxia as the COX-2. They are less problematic to the stomach and to the kidneys. So they can be used for perhaps a little longer, but generally we use them for a short time. Paracetamol is a very safe drug. Can be used in babies and can be used in the very elderly. It doesn't really have any side effects in terms of cognitive function. It's not going to make somebody dizzy or interfere with their thinking. But in overdose, it does cause liver damage, and that is a big problem. Having said that, it is available over the counter and generally very safe. The next number of drugs that I'm going to speak about, the anticonvulsants and the antidepressants, are old drugs used for primarily for other pathological conditions, such as depression and epilepsy, but have been adopted by specialist pain medicine physicians for managing particularly neuropathic pain. So in the 1950s and 60s, it was noticed that some of the anticonvulsant medications like Tegretol were used for the management of persistent neuropathic pain of nerve origin. But these were associated with significant side effects. In the late 1990s, a drug called gabapentin was launched and was shown to be quite effective for neuropathic pain such as shingles pain and diabetic neuropathy. And it was adopted for many other neuropathic conditions. It was safe, it had few side effects, and it was well tolerated. We talk about an NNT, the numbers needed to treat. So we had to have a number needed to treat of about 5 to use gabapentin. In other words, you'd have to treat 5 patients before one would get an effect, a positive effect from the drug. Later on, the same company provided and produced a drug called pregabalin, which was marketed as Lyrica. Lyrica was used because it was twice-a-day dose, it was well tolerated, few side effects, and quite effective. It's used, probably overused nowadays. It's available on PBS, but it is not effective for musculoskeletal pain, for which it is prescribed quite widely. The antidepressant medications, and particularly the older ones, the so-called tricyclic antidepressants, have an effect on the noradrenaline receptor. And the noradrenaline is a neurotransmitter which is really important in the transmission of neuropathic pain. So we use drugs such as amitriptyline, nortriptyline, imipramine, and desipramine, depending on the type of pain that the patient has. They have side effects, they have cardiac side effects, and they can make the patient sleepy. This may not be a bad thing if sleep is interfered with by their pain. So we generally prescribe them at night. So a combination of an anticonvulsant and an antidepressant is appropriate for a small number of patients with neuropathic pain. But a trial of these medications for the patient is appropriate to determine if they're effective or not. So you can see that there's a number of medications that we can use, sometimes on their own, sometimes in combination, for the management of neuropathic and nociceptive pain, knowing that both types of pain can coexist in the same patient at the same time.
Great. So thank you for that, Dr. McCoy. We've looked at so many different aspects to managing pain so far. We've looked at opioids, we've looked at this, the other range of anti-inflammatories, anticonvulsants, we've looked at neuromodulation, we've looked at pain management programs, physiotherapy, the role of psychology in managing pain. It seems that we've probably got just one aspect left to talk about, and that's the aspect of infusions. So I do hope you'll all come back for the last video tutorial on medications, and then we're going to look beyond that at where do we go from here with managing pain in its entirety. So we hope you'll come back for this next video tutorial on pickling the pain and the use of infusions. Thanks, Dr. McCoy.
Thank you.